Today marks 1 year since the first dose of a COVID vaccine was administered in the U.S. More than 200 million Americans are now fully vaccinated, and more than 3/4 of the eligible population received at least one dose. However, the latest CBS News poll finds nearly 1/3 of people who are vaccinated have no plans of getting a booster shot, in spite of evidence that regular vaccinations are not enough to protect against the Omicron variant. CDC Director Dr. Rochelle Walensky is here joining us right now. Now, as we mentioned, 3 out of 10 people who got the first 2 shots say they won't get the booster. Dr. Fauci says getting the booster shots give you optimal protection. Are we just redefining what it means to be fully vaccinated?
You know, what we know is that the more mutations a variant has, the more immune protection that you need. And so now we're facing the Omicron variant here in the United States. We have new data out of the CDC just this morning that has demonstrated that about 3% of our disease here in the United States is from Omicron, 13% here in New York. And so really we want to bolster our immune protection to fight against this variant that has a lot of mutations. And so, yes, we would really like people to get doubly vaccinated and then get their booster when they're eligible for their booster.
Are we setting people up for a conversation down the line where we say, look, every year you need your COVID booster?
You know, we don't know that yet. We have, a lot of science is evolving now, a lot of information that we're getting about how well the boosters are working against the Delta variant, and then more data that's emerging on how well our boosters are working against the Omicron variant. But we have a lot of different vaccines where you get 2 shots and then a boost and then you're done. And so what we don't know is how long that protection is going to last over time.
Well, earlier we were talking to Albert Bourla, who I know you know from Pfizer, who was talking about the new pill. What's your take on the pill? And are you concerned that people will think, well, I'm not going to get the vaccine anyway. If I get the symptoms, I'll just run and take the pill?
Yeah, the first and foremost, we need to get people to prevent disease. That's really, really important.
Don't wait till you get it.
Don't wait till you get it. Get your vaccine, get your booster, take all of those prevention measures. But if you were to get sick with COVID, then, we now have a new tool in our armamentarium, and that's terrific. So should this tool move through the FDA, through authorization, the really important thing here is that you have to test quickly, because you really need to give it within a pretty narrow window of symptoms. And so if you get
because not everybody gets symptoms, though, Rochelle. That's the problem.
And if you don't get symptoms, then you're not really at risk of severe disease or death. So if you start to get those symptoms, then you really need to test quickly and go consult with your physician or provider so that you can get this.
So if you don't have the symptoms, you don't have to, even if you get diagnosed, if you don't have the symptoms, don't worry about disease. Don't worry about something really serious happening to you?
Well, then I would actually really look and see whether you're at high risk of disease, whether you're an older population, have a lot of comorbidities, and at risk of progressing to more serious disease.
Now, not all scientists agree that young or healthy people should get booster shots. And I have friends and family that say to me, well, Nate, I'm young, I'm healthy, I'm as strong as an ox, and my immune system is great. So why are you telling me I need something if I'm good right now?
Again, it goes back to the more mutations a variant has, the more immune protection that you need from it. So we're really encouraging everybody who's eligible. 16, 17-year-olds just became eligible last week. My 17-year-old got his booster over the weekend. And we're really trying to encourage people to get that boost to bolster their protection so that they're ready should they encounter the Omicron variant.
I'm really hungry. I think a lot of Americans are really hungry for some sort of a conversation about when we start living with this virus, as opposed to being in a kind of crisis mode where we're changing the rules and we don't know if we can plan ahead.
Getting ready for the next thing.
Yeah, getting ready for the next thing. From a public health scientific perspective, when do we shift into recovery mode and out of crisis mode?
We all want to get there. We're not where we want to be right now. But what I'll say is we have 1,100 deaths every day still. And we can't be cavalier about the fact that we're losing so many lives from this right now.
And those are directly related to COVID.
Related to COVID.
Shouldn't the messaging be, though, Rochelle, as we sit here, because we're going into year 2, people think we're waiting for you to sound the trumpet and say it's all clear. We're not really going to get an all clear, are we? We just have to face the fact that we're going to have to live with this. True?
I think that that's probably true. But what I would say is we have a lot of control and power to do that as we come together, as we get vaccinated, as we do those prevention things that work to protect one another and ourselves and our family. We can bring down the amount of disease in this country and get much faster to that place.
Can I just say, I'm so glad you're here at the table, that you actually have legs. You're 6 feet tall. We're so used to seeing you from the... Yeah, we're so used to seeing you from here up. It's so great to have you in studio.
Yeah, we really
and she's 6 feet tall.
I know, much taller than I expected.
Nobody knows that on Zoom.
No, I like it.
Dr. Rochelle Walensky, thank you very much.
Thank you so much for having me.